Seoul, speak to correspondent Chloe Bourgnon, who joins us from there. Chloe, the government's talking pretty tough on this now, isn't it?
Yeah, you're right. So they just announced today that they started taking the first steps to suspend the medical licenses of the trainee doctors that are actually in the walkout. This was announced last week. They gave a deadline last Thursday that had little to no effect for the trainees coming back to work. They are also stepping up against the Korea Medical Association. So they are currently investigating the current and former leader of the Korea Medical Association because they're suspecting that they're at the origin of the walkout for the trainee doctors. The headquarters of the association have even been raided by the police last week, just a few days before the massive rally that took place yesterday in Seoul, where about thousands of doctors have attended to show their opposition against the measure that decided by the government to raise the students' quota by 2,000 extra students starting next year.
I suppose the crucial point, Chloe, is how on earth all of this is affecting patients there.
Yeah, well, as you said, it's about 70% of interns that are actually out of job in nearly 2 weeks. And they are really affecting the 5 biggest hospitals because that's where the trainee doctors are making up to 40% of medical staff. And the hospital have been explaining that they already had to cancel about 50% of their surgeries. They also are sending people with non-life-threatening conditions back home. And there have been some reports of situation of people of dire medical situation that have been sent away from several hospitals that couldn't take care of them. So even in emergency situation, the hospitals are starting to feel very strained. And hospitals are explaining that with the strike going on and the walkout keep going on, this is going to be more and more difficult for the remaining staff to take good care of people. And the strike might still go on because on one side we have doctors that are really strongly opposing this rising of the medical quotas for next year. And on the other side, the government have said that it was for them an emergency measure that has to be taken in order to be able to get better proportion of doctors because they are lacking practitioners outside of Seoul and in some very specific fields like pediatrics or neurosurgery. And it's also going to be an impending problem in a country like South Korea, where the population is aging very fast.
Chloe, thanks very much. Chloe Bourgnon, correspondent, talking to us there from Seoul.